Coming into college, I never really expected to get involved in this. I was always interested in medicine. It was during my orientation, someone had mentioned, Harper's Ferry ambulance agency on campus. I'm like, that's interesting. So I got involved. I interviewed and was accepted, and ever since it's been a really awesome opportunity. I think it's the best way to describe it. I've experienced so much, met so many new people, made tons of friends, and some memories that literally will last a lifetime. Just being able to give back to the community, give back to my peers, it's just really, really rewarding. It's something that's great about EMS, working on an ambulance. It's all about the patient, the person who's sick. They call you because they're scared, they're sick, they need help, and it's on you to make them feel better, to take care of them, to get them to the hospital, get them some more definitive care. So it's really a great responsibility to have. It's a great feeling where someone calls you, they're sick, they're hurt, and by the time you're done, you get them to the hospital. Maybe 20 minutes later, 30 minutes later, they're feeling better. It's a great feeling to have, and this opportunity I wouldn't trade it for anything in the world. And really grateful to have gotten involved in it over the past 4 years.
I'd say similar. I think if the goal of like a government-provided public service is to provide a service or good to members of a community that would otherwise be lacking if the service were not provided, I think that puts an incredible it's an incredible charge for the people actually responsible for providing that service to do it and to do it well. If the expectation is to provide a service that's better, to provide a service without which people's lives or people's livelihoods or people's social experiences would not be as good, to be able to provide a service that would fill all those voids efficiently and effectively, while being able to enjoy it as I do, I think as Alex does as well here, is really spectacular. And I think that a big part of my experience here, at least, was kind of seeing this as a learning experience, learning not only like how to provide well for our patients, how to drive the ambulance, but learning how to interact with people and learning how to take the skills that would be provided kind of figuratively speaking as a public service and translating it literally to what do you say to a patient? What do you say when you're meeting with the university administrator? If you have a concern, who do you go to voice that to? If a patient has a concern, do they feel comfortable voicing it to you? I think being the interface between the figurative concept of what is a public service and like the service delivered to in this case to our patients or to the university and the community around it, I think that's really the takeaway lesson for me, is learning how to interface between public service, figuratively speaking, and service delivered to the public.